Hi, I'm Dr. Jackie. I'll be your physical therapist today.
Awesome, come on in.
Thanks. Yeah, so today, once we get you up on the table, we're going to look at hips, the knees, just make sure that those are all working just fine, and then I'll have you flip and lay face down on the table so we can kind of palpate and see what's going on with the soft tissues in the joints. All right, so what I'm going to do, I'm just going to kind of palpate through here, kind of give you a little bit of pressure, and you just tell me if there's anything that bothers you, okay? You're doing great. Anything in there at all? No, good. That feels spicy. You're definitely a lot tighter on the right. All right, so feels a little bit different than acupuncture. It's a little bit like deeper, dull, achy kind of like pressure. If the muscle twitches, that's actually a really good thing. But if something feels uncomfortable, just let me know and we can always like take it out and reposition, okay? All right, so we're gonna kind of go to this little muscle belly right here. Little poke. That's a nice little big twitch. And that's actually what you want to happen. So as we insert the needle, what we're looking for is we're looking for the muscle to twitch. So she had like a little baby twitch right here. That's actually a really good sign that we have hit the target tissue that we want to hit. And what I'm feeling for is those areas of tightness. And that's kind of exactly where I want to go. You can kind of see a little twitch there too. And so our target is actually, we're going all the way down to your scapula. So that's kind of how we know that we are where we want to. So the nice part is that we can get those really deep muscles. Now, if you want me to, I can hook this up to like a tinge unit and we can see if we can get the muscle to twitch, but that's totally up to you.
Yeah.
All right. So just tell me when you feel, so it should kind of feel like a pulsing, and we're looking for that muscle to twitch, just like so. That looks nice. So the thought process behind this is that we're trying to fatigue out the muscles to where instead of them going back to that super kind of like knotted up state, that after this, they should all relax. And then a lot of times we'll follow this up with either cupping or doing just a little bit of light soft tissue work. And then kind of talking about some ways, especially when we're looking at like a shoulder like this, just some ways that we can kind of help to hopefully eliminate this kind of stuff from happening. Because dry needling is great on its own, but in conjunction with having the education as far as what is going on in the body and using movement to kind of help facilitate some of that, those other things, a lot of times we can hopefully prevent this from happening and continuing to occur on that repetitive cycle. Yeah, can you kind of tell me what you're feeling?
Yeah, I can definitely feel it pulsing, but it's not painful at all.
Kind of like a tapping?
Yeah, exactly.
Yeah.
Like somebody's tapping on the shoulder.